welcome to the show. Great to be with you. Thanks for stopping by. Let's talk nutrition coast to coast and globally. I got a new hat. So how do you say it? Puma or Puma?
Puma?
I don't know. We'll have to get the correct pronunciation. Good gear. Puma gear. It's good gear. I like it. And, yeah. Hope you're having a good day wherever and however you may be listening or watching the show and whatever you may be doing. We are coast to coast, as I said, and close to 60 markets now across the U.S., and we're grateful for every single affiliate. It's great. We appreciate them bringing us into your neck of the woods, broadcast woods, to educate or otherwise then empower people to take charge of their health so that they can live a long life with quality of life. Puma. There you go. Catch that? Puma. It's Puma. And a Puma is a what?
A cougar. Another term for a cougar.
And I like Puma gear. It's nice. Years ago I wore it, but I'm back to it again.
I was actually told that I wear Nikes, and I have
too.
flat foot,
Yeah.
so I should
Go to Puma?
go to Pumas.
Give 'em a
Last
try.
night, Eric told me last night, the NutriBio guy said, that's what, he goes, because I was telling him about the cramps in my feet.
Yeah.
He goes, you're flat-footed, that's your problem.
Could be you're flat-footed, could be you're a little dehydrated, could be a combination of both.
Could be I weigh 200 and...
Well, you're
pounds,
making progress now. No, don't throw yourself.
I'm not jinxing it.
Yeah,
No
just
jinx.
I understand. So I have a quiz question for the fellas, Stephen and Gary, and we'll see how they do here on this quiz. You can, take it yourself if you like. And it deals with my lead-in for today, and what I want to talk about, at least in a study that's being reported and trending. So here's the question. Which of the following prevents blocked arteries? Which of the following prevents blocked arteries? A, exercise. B, diet. C, A and B. Or D, meditation. Which of the following prevents blocked arteries? A, exercise. B, diet. C, A and B. Or D, meditation. What do you think, Stephen?
I would have to go with diet.
I would have to go with C, both diet and exercise.
Diet and exercise. And neither of you picked exercise.
No. Well, Gary somewhat did because he went with exercise.
Well, he did. It's interesting. You went with diet?
Yes.
Well, you can stay in your front seat in the class because you're right.
Take that, Gary.
Am I wearing the hat again? The dunce hat?
I thought you would go for the bait and say both A and B, and you did, thinking that exercise will prevent. That's a natural. Quite frankly, there are many health experts that believe that exercise will prevent blocked arteries. So Stephen's right. It's diet.
I would say that exercise actually could be detrimental to somebody that has blocked arteries.
So remember, who was there's been more than one, but the real famous Olympic runner. In fact, I think he was out running at the time and had a heart attack and died. Who was that guy? It was a while back. There have been several episodes of that, or examples, where runners, Olympic runners or track athletes, have artery disease. You would think that all that cardiorespiratory work would...
Ryan Shaw.
No, that doesn't ring a bell for me. He had a famous name. He was well known. This was a while back. And you would think that these athletes, especially runners, would not suffer from coronary artery disease, or any athlete that's involved in high cardiorespiratory work. This new study illustrates and provides support for to disconfirm the hypothesis that exercise will prevent blocked arteries. Apparently it doesn't. This was a long-term, this is interesting. There are more than a few people listening and watching this show right now that believe exercise is going to prevent blocked arteries. This was a longitudinal study. It had about, or a little better than 3,000 participants, and Caucasian men who spent more than 7 hours exercising each week, are you ready? Are most at risk of developing coronary artery calcification. Who just said that exercise may, and Stephen did? That is so counterintuitive. Think about that. In this study, Caucasian men who exercised 7 hours or more each week were at most risk of developing coronary calcification, artery calcification. That's a condition whereby you have a buildup of plaque in the main vessels supplying blood to the heart, coronary. My goodness. Coronary artery calcification, as it turns out, with respect to gender, is more common in men than women. And it usually develops late in life. Now, it happens, that statement is usually, they said in the press release, typically the plaquing happens over a long period of time. It takes time. And you find yourself, you don't just go to bed one night, wake up the next day, and you have plaqued arteries. No, it doesn't work that way. Some populations are considered to be more at risk of developing coronary artery calcification. When I mean populations, I don't mean ethnically. Populations meaning people that have a higher body mass index, overweight and obese people. Those who have hypertension are more at risk, and people with chronic kidney disease. I would put in that list myself type 2 metabolic disorders like type 2 diabetes and type 1 diabetes. This is a study was conducted by researchers working at the University of Illinois at Chicago, UIC, and the Kaiser Permanente in Oakland, California. And they took a look at the impact of physical exercise on the likelihood of developing CAC, coronary artery calcification. This study is a somewhat turns everything up, not everything, but it turns things upside down, doesn't it? You would think that I exercise and I reduce my risk for coronary artery calcification. Not so much. Come back, I'll tell you more. You are listening to Let's Talk Nutrition, coast to coast and globally, trying to avoid the CAC.
I'm Joy McCarthy, holistic nutritionist, and I expect more from my multivitamin. I've researched many vitamins, and what's truly different about every woman's One Daily from New Chapter is that it's fermented with probiotics and whole foods and gentle even on an empty stomach. Every Woman's One Daily helps you feel good every day, giving you immune, energy, and stress support, and nutrients for bone and heart health. You will notice a difference. Every Woman's One Daily recently won the Best Multivitamin Award, and I love that it's non-GMO project verified. Discover the wisdom of nature with New Chapter.
Whether you spend your free time on a treadmill, under a car, or in your garden, if your active lifestyle leaves you sore, Body Vigor's Inflammaforce may be exactly what you need. Inflammaforce has a natural herb blend that acts as an anti-inflammatory to help maintain healthy joint and mobility support. There are standardized herbs like white willow, boswellia, turmeric, ginger, and devil's claw. The vegetarian capsule promotes easy digestion and a fast-acting dissolve process. Inflammaforce includes a proprietary enzyme herbal blend full of antioxidants and flavonoids that target pain and inflammation throughout the body. Body Vigor's Inflammaforce contains ingredients that support normal, healthy joint flexibility and function, builds healthy tissue, and helps with your recovery process. So if you're tired of sore joints and inflamed muscles, Body Vigor's Inflammaforce is your answer. Purchase Inflammaforce.
One of the real, I guess, interesting, I wanted to use the word fun. Maybe it's not so much fun as it is intriguing and interesting, is when a study comes along and the findings are counterintuitive, unexpected, and sort of run against the theory and practice of health, medicine, and whatnot. Today, I'm reporting on such a study where exercise did not prevent coronary artery plaquing And in fact, in Caucasian men, promoted it. You can't make this up. You just can't make it up.
It's kind of scary, Doc. I'm sorry, but
I was just walking down home, went to warm up this coffee here, and I was thinking about that. I said, wait a minute. All these people going to the gym with the purpose of what? I'm doing this for my health, and I'm running, I'm exercising, I'm lifting weights, I'm swimming, I'm biking, right?
Yeah. I mean, I'm one of them. I'm that guy. I'm 43 years old. I'm a little overweight. I'm trying to get my health back. I'm getting to the gym. I'm trying to eat right.
Don't stop.
Okay.
Don't stop. We'll talk about this. Now, here's what this study, I'm giving it some attention and credence. Let me share with you from the researcher's insight into this. From my perspective as a researcher, this was a longitudinal study. In fact, they followed the participants in this study for 25 years, not 25 days. Even if you did a study where you follow people for 25 days, that's a big deal. This was 25 years. Wow. And they recruited 5,115 people from this program called the Coronary Artery Risk Development in Young Adults between March of 85 and June of 1986. The baseline cohort, a cohort is a group of people that share something in common. In this case, they all belong to that group that I just told you. And included black and white men, all of whom were between 18 and 30 when they entered the study. So this goes back all the way to the 80s, mid-80s. And then they tracked them for 25 years. In other words, you don't just get a snapshot, you're getting a film, a video, a newsreel, a movie, whatever way you want to put it. They put them in 3 categories. Trajectory 1, these are people who exercise under 150 minutes. That's 2.5 hours a week. That's below the national recommended average, by the way. Trajectory 2, these are people who met physical activity guidelines for exercising 150 minutes a week. That's 2.5 hours. And then there was the third trajectory. People who exceeded the national physical activity guidelines by exercising more than 450 minutes a week. That turns out to be, if you do the math, click, 7.5 hours a week. Now, you heard the old expression, no good deed goes unpunished. Well, that's what happened in this study. No good deed goes unpunished. Should have been the headline.
I'm just in shock.
Dr. Ledoux, and I'm not making that name up either, Dr. Ledoux said, quote, we expected to see that higher levels of physical activity over time would be associated with lower levels of coronary artery calcification, close quote. Wow, Dr. Ledoux and Dr. Ledoux's colleagues got a big research surprise. The development of the CAC was tested during the participants' final year in the study, where they were all between the ages of 43 and 55 by that time. And they used what's called computerized tomography scans of the chest area. And I'm quoting now, quote, after analyzing data in terms of race and sex, the team found that the group at the highest risk was white men, who were 86% more likely to develop CAC than their counterparts, close quote, i.e. the black men. Black men in the study, in trajectory 3, these were the men who exercised 7.5 hours a week, were not significantly at risk.
That-
What? What does race have to do with it now, you wonder? And neither were women, regardless of race or background. Women were in the study too. I didn't want to mislead earlier.
Okay.
So white men and were the group who did more than what is recommended. They thought they were doing a good deed, but they got punished. They instead of exercising 4.5 hours, it was 7.5, 7.5. And they ended up with an 86% more likelihood of getting our calcified plaque. What's up with that? Is there something wrong with the study?
It just scares me. It really does.
And I'm paying attention to the study, Gary, because they measured them and then they cut them loose. Now, and then they tracked them over 25 years, and then they measured them again at the end of 25 years. And the group that had the greatest amount of plaque were the white guys. Not white women, not black women, and not black men who exercised more than 4.5 hours a week. I'm confused too. Welcome back. Welcome to Let's Talk Nutrition, wherever and however you may be listening or watching the show, and whatever you may be doing. Boy, this study is confusing, isn't it? It's so counterintuitive. That's why I'm reporting on it. I love it when the furniture gets moved around and you go to sit in the chair and it's not there and you fall down. If you follow my metaphor. As a researcher, I find that intriguing, and especially when it seems like it's a pretty good study. I couldn't get my mitts on the entire study. I wanted to see the methods section, but it was longitudinal, took 25 years. They tracked them for 25 years, the participants. If you just tuned in, well, here's what they found. I would have headlined it, "No good deed goes unpunished." And what I mean is this. Those who exercised 150 minutes per week, and those or under 150, they went for 2.5 hours, and those who exercised for 150, they fared okay. Both white men, black men, white women, black women. White men who exercised 450 minutes a week at 7.5 hours, guess what happened? Not good. 86% of them were at a greater risk for developing coronary artery calcification. Hence, no good deed goes unpunished. What happened? What happened? Why? How do you explain that? I wonder if my guest today, Dr. Mike, he's awfully bright. I wonder if he has a thought or two about that. If they went above and beyond and thought they were, you know what, I'm going to stay a little longer and do a little more because I'm going to get a better result. Because I'm into health and I want to take care of myself. Really? Yikes. Dr. Michael Lyon, we're going to talk about this for a minute. Dr. Michael Lyon is my guest today. Always enjoyed Dr. Lyon on the show. He's been on more. I always wanted him to be on more than he was in the past. Now he is. I got my wish, and we're enjoying it because his approach is scientifically based and sensible, and we'll see what he has to say about this. Dr. Lyon, welcome back to Let's Talk Nutrition. Great to have you on.
Great to be back on your show, Dr. Garko.
How do you explain that? Explain me what happened in that study.
Can you just send it back to me another way, just so I can think it through one more time?
Okay, so here's what happened.
Not intuitive.
All right, so they had 3 groups. Group 1 exercised under 150 minutes a week, 2.5 hours per week, which is below natural physical activity guidelines. Group 2, or trajectory 2, they met physical activity guidelines, and they exercised for 150 minutes a week. Okay? So they actually did 2.5 hours. The first group, under 150. The third group, or third trajectory, though they exceeded the national physical activity guidelines, and they exercised for more than 450 minutes, or 7.5 hours per week. That group, and to the surprise of the researchers, the participants who had the highest levels of physical activity, that would be group 3, were 27% more likely to develop CAC by middle age compared with people who exercised for under 2.5 hours per week. So they were at greater risk for coronary artery calcification.
Sure.
And this caught the researchers by surprise. And they thought that, they hypothesized that the group that engaged in more fit exercise would do better with, in a sense, there would be less plaquing for them in their coronary arteries. Not the case. In fact, they were 20% more likely to have it. So what would be, if we were in that study, in the conclusion, we would have to offer some explanation as to why that might be the case. I have
and it's
some
not the
ideas. I'm
first
curious as
time.
to what you think.
Yeah. It's not the first time that that things have hit us from the side when it comes to the idea that with exercise, there's two things we thought for sure. One is the more the better, and the other is the more more intense the better. And although there is a place for more and for intense, it can easily become a source of just pure injury to the body. First of all, exercise is injury. That's what it is by virtue of its very nature. The only thing that you can do to gain from exercise is to break down your body a little bit by doing a bit more than what is happening at rest, as far as muscle breakdown and bone breakdown and so on. It causes a storm of inflammation after every workout. That's one of the things that we know. When you work out, you're bringing a lot more oxygen into the body. You're causing microscopic trauma throughout the body from pounding and pulling and different things. And in the period of rest, there is there's kind of like a storm of inflammation that occurs. It's sort of a mini inflammatory storm. It's not mini when it's, say, after a marathon race. You really feel it. You feel like you've got the flu, and you've got a lot of muscle breakdown products that are measurable in the blood and so on. But after a typical or run or weightlifting exercise, there's still damage to the body, and there's like a storm of inflammation that occurs. Now, the benefit of exercise is your body gets a little bit tougher and able to resist the storm the next time around, and it rebuilds in preparation. But the problem with just taking the idea that you have so many minutes of exercise a week, and that's the magic. Problem is, people will try to, if you take a typical individual who's going to be in the high-end group, they're going to be one of those people that's going to go and do CrossFit, for instance.
Yep.
And again, nothing wrong with CrossFit, but if you don't work your way up gradually, what you end up doing is just traumatizing the body in a molecular way, to the point where you get so much damage between your workouts, there's not enough time to really rebuild, and you end up having, and this is not the first time really, that there's really good evidence now that in extreme athletics, you're seeing in, for instance, the examination of the circulation through the heart or the cardiac muscle later in life, evidence that these people are developing specific kinds of cardiomyopathies or diseases of the heart. And also they've shown cardiac coronary artery calcification in those people. So it's not the first time that the high end of the exercise spectrum is not looking as perfectly good as we thought. And
that's an interesting point, and we're headed into some messages. Further, in terms of race, who do you think ended up worse in doing more, white men or black men? We'll see. Diet and exercise. You hear that all the time. Diet and exercise. Diet and exercise. I should tell you that exercise is not the best predictor for weight loss. It's a poor predictor. And if you think you're going to lose weight just by exercising alone, you might more likely be disappointed than not. My guest today is Dr. Michael Lyon. Dr. Lyon is a practicing physician in Canada and has a wonderful clinic, weight loss clinic, and they help hundreds, if not thousands of people every year. They see several hundred patients a day who are overweight or obese. Usually it's obese and difficult cases. And so they've developed quite a library of data on weight loss and how to do it and whatnot, the best way to do it or safest, most effective way, psycho-emotionally, physiologically, socially. I mean, it implicates everything. Dr. Lyon, welcome back. This study is intriguing. White men were 86% more likely than black men and black women and white women to develop coronary artery calcification. That's interesting, too. Generally, though, overall, people were 27% more likely to develop coronary artery calcification if they exercised 7.5 hours a week compared to 4.5 hours a week. So more was worse. Interesting, isn't it?
Yeah, I wonder how did they assign people to the groups, because it's hard to say to somebody, this is how much you're going to exercise, and for them to actually do it. So
I don't know.
My impression is that, when people are, first of all, in a way, I kind of loathe when there's another negative study about exercise, whether it's that exercise isn't effective for weight loss or that too much exercise causes some sort of problem. Because
sure.
The reality is that very few people really exercise, and it's the best thing you can do for yourself. So you can say without a doubt that getting more exercise is generally what everybody needs to do. But then there's always that subgroup of people who want to go and do the boot camps and the CrossFit and just a lot more than is probably realistic, particularly in that it doesn't tend to be the whole lifespan where they do that. They tend to sort of get into these kicks and they go gung-ho to the gym for a while, and then it sort of peters out. I think that's the biggest problem. Like for me, I'm kind of an exercise fanatic in the sense that from the time I was a kid, I've been, after I had, started to really struggle with my weight, I started to exercise regularly, started running and then cycling, and now I'm almost 60, and I live, in an area where I'm right on the edge of a, mountainous forested area in Vancouver, Canada, and I get out at least 3 times a week on my mountain bike, and I'm kind of crazy. I'll be up there at 10 o'clock at night with bright lights by myself on the top of a mountain thinking, what is a 60-year-old guy doing about ready to descend this kind of extreme mountain bike trail? But at the same time, I've been doing it all my life, so I think it's still probably a net benefit to me. And
so I'm sorry. Go ahead, please.
Well, I'd say I do fairly intense exercise, but it's something that my body has had a chance to adapt to very, for many, many years. That's kind of been my norm. And still to this day, if I get too busy and I don't do something fairly intense as far as exercise, I'm very careful to just go out and walk my dog for a few days. Like, I don't dive right back in and do what I was doing 3 weeks ago if I haven't been doing it. And I think that's a fairly good principle. Sure. Is if you love exercise, if you're one of those few people that really do, then try to be as consistent as possible.
Yep.
And when you haven't been consistent, be very gentle on your body for a while. Don't overdo it.
Sure.
I think that going back to the gym and getting a personal trainer when you haven't been doing much is necessarily the best idea.
So this study presents an interesting dilemma. It leads me to what I wanted to chat with you a little bit about. I'm sure this has come up in your clinic. So let's use this study as a platform to get me there. So in this study, we see that exercise and in 7.5 hours a week had a deleterious effect for a particular group population that is white men. Now, typically we say to people on this show, for example, exercise is good for health, right? That's one message. Now today, here I am reporting on this particular study and then asking you to comment on it, where exercise may not necessarily be good for health in a particular instance. That presents what we call in communication a double bind. It's a paradoxical message. On the one hand, I say to the viewer and the listener of this show, exercise, keep moving. I wish I had $1 for every time I said that. Exercise, keep moving, keep moving. And then today I report on this study. Now I've created a double bind for the listener and the viewer. And it's paradoxical. And it's confusing. I think often this happens with weight loss as well. And I wanted to see what you thought about this. We see a lot of paradoxical messaging. What Gregory Bateson and that whole Palo Alto group of scholars called paradoxical communication or double bind message, that double binds. On the one hand, we say to people who gain weight or who are obese, look, Paul, it took you all these years to gain all this weight. And now we're going to put you on a weight loss diet and we're going to lose this weight, 5, 7 pounds, 10 pounds a week. In other words, there's a confusing message. Paul may be thinking, wait a minute, I've been heavy my whole life, and now they're going to get me to lose this weight in just a short period of time. It's conflicting. In other words, something that took a long time to create is now we're going to solve it in a short period of time, which ends up being disastrous. We come back, we'll talk more about it, okay? We're running out of time on this hour, Dr. Lyon. We'll come back, I'll get you to comment on this. And if you can think of any double bind or paradoxical messages that exist in the literature or in advertising and marketing that are communicated to obese people and causes confusion. We'll explore that with Dr. Lyon today. Dr. Michael Lyon will be my guest. He's also an educator for Nordic Naturals, in addition, natural factors, in addition to being a clinician and a physician. We love having him on. You are listening to Let's Talk Nutrition. We're coast to coast. We'll be back in a few. Catch these messages at the top of the hour. Welcome to Let's Talk Nutrition, wherever and however you may be listening or watching the show, and whatever you may be doing. Dr. Michael Lyon is my guest, and was talking with Dr. Lyon in this earlier part of the show about this new study out where more exercise ended up being not such a good thing for a certain particular group of participants in the study. It was white men. They ended up with a greater likelihood, white men in particular, a much greater likelihood of developing coronary artery calcification. And generally speaking, those who exercise more than 4.5 hours a week, it was like 7.5 hours a week, those people had a 27% greater chance of having plaque, coronary artery calcification, plaque in their arteries. Yeah, no good deed goes unpunished. Like Dr. Lyon said, he's loathed when to learn that when these studies come out, because they're counterintuitive and they present a conflicting message, a paradoxical message, a double bind. On the one hand, you say to somebody, keep moving, exercise is good for you, and then at the same time report on how exercise can lead to putting you at risk for coronary artery calcification, which could lead to heart disease. That's a double bind. Paradoxical. These kinds of messages, though, happen in marketing and advertising when it comes to weight loss. It depends on what level of abstraction the messaging happens to. Sometimes it's at a level of abstraction that you don't quite, it's not explicit. For example, on the one hand, you go to some clinic somewhere and they sit you down and they talk to you, saying, well, you know, it took you a long time to gain this weight. This didn't happen overnight. And they go through that whole narrative with the patient or the client, and then put them on a weight loss program. They're going to lose all the weight in 6 weeks or some ridiculous. That's confusing, and it's paradoxical. And it usually doesn't end up well anyway, right? So Dr. Lyon may know of other double bind messages, paradoxical messaging that goes on in the weight loss world. There are others, but he's an expert. He's one of the, in my opinion, Dr. Lyon is one of the world's leading experts. And I say that not in a hyperbolic way. I don't need to prop him up.
He needs to come to Florida for me.
He does this every day, all day long, with hundreds and hundreds of patients in his clinic. And he's been doing it for years, and he takes a scientific, evidence-based approach to nutrition as well as weight loss. So but he has such a wide range of experience with all kinds of people in losing weight. And that his clinic is constituted of all kinds of different professionals, psychologists, dietitians, MDs, NDs, who knows? I don't know. He may have priests doing exorcisms there for all I know. Dr. Lyon, welcome back to Let's Talk Nutrition. It's great to have you on. Are there paradoxical messages in the world of weight loss and, dieting and all that? Have you found them to be existing?
Oh, there certainly is, yeah. And unfortunately, the messaging that people are hearing when it comes to weight loss, it's what sells. I guess what sells more ads or more products, but it isn't necessarily going to be the thing that even helps people. Like if you want to say something in an ad about a weight loss product, and if you're truthful about it, you're probably going to say something that if people really believe it, they're going to probably use the product longer and get more out of it than if you say things like achieve permanent weight loss or achieve your ideal body weight, which is one I heard fairly recently. And let's just be honest here, like you have a product like PGX that really works, but then they seem compelled to be able, they have to say it'll cause something that is, sort of tickles the fancy, like you're guaranteed to achieve your ideal body weight or something, for instance.
Mm-hmm.
And the problem is that people start taking a product like that that's helpful with this short-term mentality. If I don't lose 7 pounds a week, or if I'm not losing weight at such a rate that by this summer I'm able to, be this weight, then they feel discouraged and they give up. The way that we work with people, it's completely different. We do work with, for instance, with PGX, which is a dietary fiber that's got effects that are beyond any fiber that's been studied. It's something that has the greatest effect on the glycemic index of any fiber. It's something that has the greatest water holding capacity, so when you take it with food or in a meal replacement, it creates a lot of stomach volume, and it's very helpful. So when you have someone who's on a calorie-reduced diet, working hard to lose weight, they feel a lot fuller and more satisfied on it. Their blood sugar doesn't go up and down like a roller coaster. But the messaging we give is very different. We don't say, lose 7 pounds a week, or you've got to achieve your ideal body weight or something like that. We say, let's be honest here. If you have a serious weight problem and you want to make changes, this is a journey that's going to last the rest of your life. There's no way around it. And for you to have the strength to do that, you have to take small steps. You've got to attack this not as this giant goal, I've got to lose 150 pounds or something, but what can I do today that I have the strength to do, and how can I use that to build on the journey that I've taken with another step tomorrow? And so something like PGX becomes a partner in a lifelong journey rather than some quick fix weight loss scheme. And the problem with the quick fix is that, you can lose 7 pounds a week for a while, starving yourself, essentially, being on some crazy diet, 500 calories a day or something like that, an HCG diet, say, or some extreme low-fat, high-carb ketogenic diet that you're, still on 600 or 800 calories a day, something that's extreme. You can lose the weight, but then your body eventually starts to fight you tooth and nail. Like, your body will fight you eventually to get that weight back. And the key to long-term success with weight management is to get your body on your side. You don't want your body to start to panic and thinking that you're going to kill it by starving it.
Yeah. Didn't you say recently when you were on the show, let's say that a person gains up to 250 pounds, all right? They were once 150. Now they're 250. Once that maximum, that weight is reached, the body, no matter, and let's say that they go on a weight loss program, whether it's at your clinic or somewhere else, and they're doing quite well at your clinic, the body is fighting to get back to 250, isn't it? That becomes the set point, isn't it?
That's right. Your normal weight is the maximum weight you've ever been in your life. That's what your body believes is your normal weight, and it's like a gravitational pull. It will start to pull you back to that weight. Now, if you've lost a lot of weight and you've made big changes in your life, and you feel like you're out in the clear and this is your normal weight now, this lower weight, realize that you're just like a satellite that's just far enough away from Earth that you don't feel the pull of gravity quite yet. But beware that when weight gain begins again, which it will at some point, if you're not careful, it's just like that satellite. As it starts to get a little closer, the pull gets stronger, and all of a sudden you're pummeling towards the Earth in a pile of flames, and it's like weight regain. If you start to regain your weight, it's like a freight train that starts, and to stop it is very difficult. So people end up regaining weight and going past the point where they started the weight
and then they
loss.
create a new set point.
That's right.
They go to 275, and now the body wants to go and say, no, I'm not going to let you be at 150. We're going to get you back to 275.
Almost 52% of men experience erectile dysfunction and benign prostatic hyperplasia. If you've had challenges with virility, sexual health, or low energy, Body Vigor's Alpha Extension may be the answer for you. Body Vigor's Alpha Extension can help revitalize your alpha male and extend your love. Our formula is one of the highest quality nutraceuticals available, formulated to support the processes involved in promoting a healthy male sex drive, energy, and stamina. Alpha Extension has 2 powerful herbal blends: Virilo Max, which focuses on male sexual health, and T-Pump Activator, which helps balance your testosterone levels. Revitalize your alpha male with Body Vigor's Alpha Extension. Exclusively available on Amazon.com.
Welcome back. Welcome to Let's Talk Nutrition. Dr. Michael Lyon is my guest today. And you heard him allude to PGX. PGX is a product made by Natural Factors. It's been on the market a number of years. And it's clearly a weight loss product, but contributes to better metabolic function, better blood glucose control, for example, or in specific. And it is weight loss, and it's fiber. It's a particular kind of fiber. It's a polyglycoplex. It's a blend of, and we'll get Dr. Lyon to explain what that's all about. And there is science to support clinical trials to support it. Dr. Lyon uses it, I presume, in his clinic. And they're always doing research, and you got the University of Toronto and other institutions, I'm sure, involved. And it's found in health stores throughout North America, easy to get. And and it's a program. I'll let Dr. Lyon explain what they do in the clinic, and maybe he can do that so that it can help you, the listener and the viewer, maybe adapt it in your own way here. You can't go to you're not a citizen of Canada, and you have to be referred to his clinic. Dr. Lyon, welcome back. Could you share that a little bit, or are you concerned about that, doing that on the air? What the diet looks like and what the program is? Maybe the listener and the viewer of Let's Talk Nutrition could use what you say today to help them?
Sure. There's so many diets out there that get promoted. The last time I looked into it, there were 35,000 diet books published every year, and everybody has a diet that the publisher wants them to be able to say, this is the diet, this is the one that's going to be your answer to weight loss, and hopefully they want it to say permanent weight loss somehow. This diet's going to help you fix the problem. Now, the reality is that it's not possible to say there's a perfect diet. There's some diets that are superior over others for weight loss. I would say if you just did nothing, like there was a nutrition professor that simply reduced his caloric intake down to 1,200 calories a day, but it was nothing but Mars bars. And he wanted to prove you could lose weight on Mars bars if it was 1,200 calories a day, and he did it. He probably felt like he was going to die by the end of it, but yeah, you can lose weight on 1,200 calories a day of Mars bars. But that'd be one extreme, and then on the other would be the very popular diets like the paleo diet, the low carb ketogenic diet, and so on. These are diets that can be done in a way which is quite healthy, and some people love the diet, stick with it, eat it in a way that incorporates a lot of vegetables and not just a bunch of processed meats and so on. They're doing it in a sensible way, and it does have some superiority for weight loss. But the problem is that if you're going to use a diet for weight loss, it needs to be a diet that allows you to transition once you're back to where you feel like you've got to be eating more normal amounts of food. You've got to eat a diet, or you've got to transition to a diet that you can live with forever. And that diet's going to be a diet you enjoy, and it's going to be a diet that doesn't make you feel like you're depriving yourself. And for most people, the low-carb diet doesn't cut it. Most people, in fact, I had a room with 80 new patients the other day. We do a lot of our work in big groups, and we had 80 new patients that had been referred to our clinic that had gone through their initial internal medicine workup and so on. And I was introducing the program to 80 people, and I was explaining the different options for weight loss. If people are here, they want to start with some weight loss, and I said, here's an option: is the low carb ketogenic diet. We have dietitians here who will guide you if this is what you want to do. But let me just tell you that this diet, if it's the diet for you, is a diet where long term you're going to have to give up all rice, all bread, all starchy vegetables, anything that has any starch or sugar in it, and essentially it's going to have to be a lifetime commitment. And how many people here would find that to be tolerable at all? 2 people put up their hand. And I said, okay, well, that kind of proves my point. When it comes to picking the right diet, it's first of all, it's going to be the diet that's going to be something you can live with forever. And so I said, and most people will choose this path, that as far as science goes, a simple diet that really works, that allows you to transition to whatever diet is going to work for you long term, is a diet that is called a partial meal replacement diet. And it doesn't sound intuitive that this would be a sensible thing to do, but I can say there's more science on this diet than any of the diet book diets out there, and that is where you have a meal replacement for breakfast and lunch, a meal replacement shake typically, and then for the evening meal you have a small controlled meal. And if you want to really keep it under control, you have a frozen defined dinner, like a meal, like a lean cuisine or one of those kind. And then in between your meals you have snacks that are part of a menu. And so this is what we call a structured diet plan, or a partial meal replacement structured diet. And the reason why I say this diet makes sense is that you can stay with this diet, and with our women we have them go down to 1,000 calories a day, men typically 1,200 calories a day, and you can lose weight as rapidly as possible without losing a lot of muscle. And then as you start to feel like you've done as much weight loss as you can, you start to add back a real meal instead. And by that time we've been working on teaching you how to make healthy breakfasts, how to make healthy lunches, how to make healthy dinners, and so on. And you start to sub in a real meal that you make yourself, or that you find at the store that makes sense. And bit by bit you start to compose the diet that's going to work for you. And that means that if you have certain, say, ethnic preferences for food, you can transition onto that diet. If you want to stay with more of a low-carb diet, because this diet is relatively low in carbohydrates, you can stay with a lower-carb diet if you want to.
Okay, we'll continue, and we'll explore this particular paradigm further.
Women who are pregnant or planning to have a child have specific nutritional needs. Maintaining optimal nutritional intake is important for mother and baby. Body Vigor's Preferred Prenatal can help mother and baby receive the appropriate building blocks for growth, development, and healthy function. The Preferred Prenatal formula provides essential vitamins and minerals, along with added support ingredients such as folic acid and DHA. Preferred Prenatal also incorporates a bonus herbal blend to help the mom-to-be with the uncomfortable side effects of pregnancy, like nausea, vomiting, mood swings, and uterine health. Support a healthy pregnancy for you and your baby with Preferred Prenatal, exclusively on Amazon.com.
Dr. Michael Lyon is my guest today. Dr. Lyon, director of a clinic in Canada called Medical Weight Management Program, and he's talked about it on a number of occasions. It's an important way they approach the whole idea of weight loss, and they've had a great deal of success. And I'm at the website now. It's the Medical Weight Management Centers of Canada, Inc., and they talk about an interdisciplinary, evidence-based, individualized, long-term approach to assess and treat patients with obesity. And he has a team of professionals working together every day. They see hundreds of patients every day that are referred to the clinic. And they point out in their website, this is not a cosmetic weight loss program. This is done for your health. And it's comprehensive, and it works. Dr. Lyon, welcome back. I noticed in reading some of the narrative at the website for Medical Weight Management Program, they mentioned the 5 A's of obesity management or weight loss. 5 A's. Do you know off the top of your head what those 5 A's are? I couldn't find it. But
five A's of obesity management is actually something that was derived from 5 A's used to help people quit smoking and essentially, to get free from other difficult behaviors. And it's really just a way for a doctor or healthcare professional who's working with someone struggling with their weight to stay organized and thoughtful about dealing with the person, because it's not as simple as saying, okay, here's the magic diet, this is what you do. So it starts by asking permission to talk about their weight and explore their readiness for change, because someone comes into a doctor's office struggling with their weight. They've been beaten up by doctors so many times. Sometimes the last thing they want to do is have a doctor start to talk to them about their weight, because usually it involves saying, you need to lose weight, and just kind of wagging their finger and saying, figure it out, without really any help. So gently asking for permission in a non-judgmental way is something that often kind of opens the door.
So you're asking to be able to. Well, is that what you're doing? You're asking.
I'm here to support you. I'm not here to accuse you or blame you, beat you up. I'm here to be a resource for you if you really want to start to turn some things in the other direction, because you've got health problems related to your weight. Let's just know that I'm a safe place to talk about that.
Okay, so these are like intervention steps, right? The 5 major steps to intervention. So ask is the first one.
Assess is the most important one, really, because if you don't know why the person has become heavy and what are the barriers that are going to be in their way to long-term weight management, there's no way you can help them really lose weight. If you do, they're just going to regain their weight. So you have to assess the reasons why they gain weight, the barriers that will be in their way, and also, just because they appear to be overweight doesn't mean they're necessarily unhealthy. There's some people who carry a lot of extra weight, and they're physically fit, they have a good diet, they don't have any cardiovascular risk factors, there's no sign that diabetes is anywhere near, they're mentally healthy and confident. Some of those people are just fine. Leave them alone. And because weight loss is not an easy thing. It's not something that you necessarily embark upon unless there's a good reason for it. And so sometimes assessment means you assess them and find out they're actually pretty darn healthy. You reassure them. And so they're not feeling like they're a walking time bomb just because they have a certain BMI. And then advising on health risks and treatment goals. So, a treatment goal, like sometimes a patient will say to a doctor, "Doc, what should I weigh?" And say they're a really heavy person, they have a high BMI, maybe it's 45, which means, say 350 pounds if they're 5'10" or 5'9". So say their BMI is 45, and they say to the doc, "What should I weigh?" And the doc says, points at the BMI chart. Well, your BMI should be 24, so that means you should weigh 145 pounds.
Oof.
Well, that's just darn crazy.
That's not going to happen.
You don't give a person that goal. When their BMI is 45, if they can lose about 5% of their current weight, they're going to put themselves into a much better health state than they were. And that's a really great place to maybe start, and sometimes that's an achievable goal that's more realistic than saying, well, you've got to lose half your body weight or it's all over. It's that all or nothing mentality that ruins people, thinking, if I don't lose all the weight, I'm a loser. Well, no. You have to be willing to consider this a journey you're on for the rest of your life. So whatever you're going to do, make sure that you've got the long-term picture in mind. And you are pacing yourself. It's about pacing yourself. You have the strength to make a certain amount of changes, but you can't do it all. And so advising on, on the treatment options available, that might include, for some period of time, a specific weight loss diet, like a meal replacement. Partial meal replacement diet is a reasonable effort to make if you want to, say, take off a certain amount of weight. If you want to lose 20, 30 pounds or a certain percentage of your body weight or sometimes more, a partial meal replacement diet is probably the most sensible way to go about it. For instance, if a person is wanting to do it on their own without medical supervision, or in our clinic where we deal with so many people, we give that as an option because we have so many people. We don't have the resources to sit one-on-one and counsel every single person about every little specific about their diet right up front. So essentially, we have to find a way that is really simple, that is nutritionally sound, that keeps people on track for weight loss day after day, and a partial meal replacement diet is really like that.
Sure. So this makes sense. And I'm glad you explained that, because what it gives the listener and the viewer of Let's Talk Nutrition a sense of is the, can I put this? And I want to send the wrong message here. It's more the complexity of it all. In other words, this is not just about eating less carbs and you're going to lose weight. This is something, what you're doing is far more comprehensive, individualized, empathetic, and so on. In other words, you ask the question, why did they gain all the weight? You explore that. The people in your clinic, your professionals, healthcare professionals, explore that with the patient. In other words, their relationship with food. How did you make this journey to obesity? How did you get here? And talking about that, rather than watching a TV ad and seeing that, oh, this company will deliver food to my house and all I got to do is eat that and I'll lose the weight. Oh, really? Okay. Come back, we'll have the LTN Health question of the day.
Women who are pregnant or planning to have a child have specific nutritional needs. Maintaining optimal nutritional intake is important for mother and baby. Body Vigor's Preferred Prenatal can help mother and baby receive the appropriate building blocks for growth, development, and healthy function. The Preferred Prenatal formula provides essential vitamins and minerals, along with added support ingredients such as folic acid and DHA. Preferred Prenatal also incorporates a bonus herbal blend to help the mom-to-be with the uncomfortable side effects of pregnancy, like nausea, vomiting, mood swings, and uterine health. Support a healthy pregnancy for you and your baby with Preferred Prenatal, exclusively on Amazon.com.
Here's the LTN health question of the day. Having a nice, very nice, enlightening, illuminating conversation with Dr. Michael Lyon. And I asked him about the 5 A's. This is a model that's used in intervention to help people quit smoking, and it's made a lot of headlines with smoking, but it's also used as an intervention model for weight loss. And the 5 A's are simply, and the question is going to deal with this model, where you ask the healthcare professional, if it asks, he advises or she advises, assesses, assists, and arranges. And what you ask is asking the physician asks the patient about weight, nutrition, and so on. They do that. Then they advise. Then, like Dr. Lyon will provide the patient with some clear, good, strong, sensible advice. Assess, where the physician will tell the patient, assess the patient's readiness to change, and so on, that readiness to change. And assist, the physician will provide counseling to help, or self-help materials, whatever they do in the clinic, and then the physician will arrange for follow-up and so on. Dr. Lyon said of those 5 stages, one was really the critical one, the most important one in his mind. Which one was it? Was it advise, assess, ask, advise, assess, assist, or arrange? Which one of those 5 was the most important one in his mind? Ask, advise, assess, assist, or arrange? I'll give you a hint. Somewhere in the middle. Here's the number to call.
You can reach us at 877-897-8255. That's 877-897-8255.
Give you another hint. You know this from your own experience in life. How motivated are you to do anything is going to determine, in the end, outcome. It's going to account for a lot of the variance as to whether you'll succeed or not. And the physician, the healthcare professional, such as Dr. Lyon, is going to have to figure out how motivated you are. I didn't use that language in the model, but there's one of those steps that gets to that. Dr. Lyon, welcome back. I'm really glad that you explained that, because it's not as easy as watching a TV ad, seeing these meals, and say, if I just order these meals, I'll lose the weight forever and ever, and I'm all done here, right?
It's quite possible that you could order the meals, and if you stick with it, you'll lose the weight. But if you don't have any sense of how you're going to maintain that weight loss, it's just not going to be possible to keep it off. People always come in with the impression, if I lose the weight, if I can only lose the weight, I know what to do. That's such a typical statement, and people think they do, but it's not about just knowing what to do. It's about the fact that, like that gravitational pull, your body will want that weight back again, and it's going to fight you, it's going to trick you, it's going to do what it can, and you have to be ready for that. When I talk about how people are going to achieve their real weight loss goal, which is often a lot of weight loss, and our goal initially is not to focus on that, it's to focus on the small changes they need to make to achieve a step in the right direction. That's what we try to get them to focus on, and their goal is to lose, say, half their body weight. Well, I say it helps me to tell you how to do this big goal of yours by I've been watching a show on Netflix called Turn that's about the American Revolution, and it's gives you a lot of insight as to how these small bands of ragtag guys back then were able to take on the biggest empire in the world, the biggest military, and they did it by strategically looking for small battles they could win with the small resources they had, and once they won, to put all the resources into holding their ground. It was so much about holding the ground when you look at how it happened over such a length of time. It was by winning a little battle here, a little battle there, but then they didn't walk away from the from the victory, they spent all their resources on holding their ground. And that's like a metaphor for how people make big changes. They look at the small things they can do with the strength they have today, and once they've done it, you give up, say, I'm going to give up sugary drinks. Okay, great. Well, don't move on to the next step until you really think you can hold your ground with that one. If you lose 5 pounds because you made a few changes, put all your effort into holding your ground. Don't think, if I don't lose 50, I'm a loser. Just think about the American Revolution. It was won by a series of tiny little battles that were persistent, and that's the way people got to be. They've got to get this mentality that if you're going to make a big change, you better be able to stick it out. And,
on the show, I talk about that same thing, and I use the concept of small wins. And this is a concept that came out of organizational theory. And when I was a professor, I would teach organizational communication and organizational theory. And Carl Weick was the social psychologist, organizational theorist that talked about and wrote about small wins. The small wins put together end up being the victory, leads you to victory or to succeeding. Just like you just said, those small wins. Let's go to St. Petersburg, Florida. Carol, what did Dr. Lyon think of those 5 A's was really the critical one? Ask, advise, assess, assist, or arrange?
Assess.
Yeah, where the verbally assesses with the patient, the physician verbally assesses the patient's readiness to change. How ready are you to make that change? What's the commitment? Congratulations, you won a $25 supplement. There you go. Congratulations.
Awesome.
That's our pleasure. Thank you for listening. Dr. Lyon, I know we didn't talk a lot about PGX today or any particular product from Natural Factors, but you made a great contribution to the show. I know the audience appreciated it.
Great to be on your show, Michael.
Yeah, it's always nice to talk to you. We'll catch you again, and in the meantime, stay tuned to Let's Talk Nutrition. We do this 5 days a week, the schedule, and we'll catch you. We'll be back again tomorrow. Visit the website, letstalknutrition.com, and there you will find everything on demand, the verbal, and the audio, and the visual with the videos. Your health is your wealth.